You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, he says nobody should be wearing a loose fitting denture. With us, we have an expert on this topic of mini implants, Dr. Randy Staples. Welcome to the program.
Thanks for having me. I really appreciate it.
Now, before we get into today's topic, for people that don't know you, your practice, who's your typical patient? What are the different services you offer?
I'm a general dentist. I'm the typical patient is just what you said, a typical patient. They may come into my office with a missing tooth or one or more missing teeth. They may have a broken tooth. They're in pain or not in pain, and but they're just wanting to get their smile back or want to feel comfortable. It's great. It's important to have a good smile, and that's what I try to do now, is give people their smiles back.
Okay, now today's topic, we're talking about mini implants. And I said, no more dentures. You do not like dentures.
I do
You
not
told me
like
in the
dentures,
green room.
Yeah, I'd actually stopped doing dentures just because I got tired of the complaining. I don't care who makes them, where they send them. In my opinion, lower dentures just don't fit. I tried gimmicks. I even said, I'm going to charge you so much for your upper denture and give you the lower, because if I don't charge you for it, you can't complain about it.
So because the lower is really that
That's
tough to make
correct.
work.
Yeah, and there's so many people walking around with lower dentures that are rubbing and hurting and just jumping all over their mouth, and they're having to glue them in or goop them in and do this 3 or 4 times a day, and they think that that's normal. That's the word we've got to get out. They think that that's a normal thing, for them to have.
So your feeling is that, and I don't want to put words in your mouth, but that the problem with dentures is they're not attached to anything.
That's correct. They're moving around. On the upper denture, some people, by the physiology, some people can have suction on the upper denture and it'll stay in place somewhat. But the lower denture is it's in there all by itself. It's just out there. And when they bite or chew something, somebody comes up and hugs them. They're afraid they might jump out of their mouth. They go to a restaurant. They're looking on the menu. They're not looking like you. You might be looking, what kind of steak do I want? They're looking for what's soft enough that I can eat it, where my dentures won't jump out of my mouth. So,
Do they tell you that?
yeah, absolutely. They tell me that. Yeah,
Like
sure
on the
do.
console? Now, are there a lot of people where you are, like within an hour of your practice?
Absolutely. There are a lot
A
of
lot of
people.
denture
There are a lot of
wearers?
people an hour of this building right here, and just within an hour of this building, there are people walking around in this complex who have dentures. Sure are.
I told you this in the green room and you smirked. I said, I know a couple denture wearers.
Yeah.
They never complain.
You're not a dentist. There are
Okay.
people. There are people and they don't just hover together. Denture wearers just don't hover together, but they're out in the general world, and they think that this is normal. This is what it's supposed to be like. They went to the dentist when they were younger. Maybe they had a tooth filled and filled again and filled again, and then the dentist said, we need to pull this tooth. And after they pulled so many teeth, they had all their teeth pulled and had a denture made. And that's it,
So nowadays, there's no more adhesive with mini implants.
With mini implants, there's no adhesive. That's correct.
So if there's so many people that are wearing a denture, like an upper lower denture, would you say in your area like thousands?
Thousands.
Okay. If it's so good, why aren't they all doing it?
I don't think they know about it. They've been told that, maybe they had a tooth that had to be pulled, and they had enough teeth pulled, and they got a denture, and they were either told by their dentist or by other people. That's it. They've got this in their mind. Now I'm in a denture.
So they don't
I'm
go to
40
the
years
dentist.
old and I'm in a denture.
All right.
And I may have to have them relined. I may have another set made when these kind of wear or break, but I'm in a denture. That's what I'm going to do for the rest of my life. I'm in a denture, and I'm going to have stuff in my pocket to glue them in. And when I get home, I'll put them in a jar, or put them on the desk, or put them in my purse, or whatever. And they're stuck in that rut. That's where they are.
Okay.
So I just don't think they know about it. I don't think they know there's a procedure available where we can stabilize those dentures, sometimes less than an hour, and they can walk out of the office and go and eat a meal. And
I think you told me this, that people can walk in with no teeth on the
No
day of the
teeth.
procedure.
That's correct.
And walk out with a full arch of teeth.
That's exactly right.
Is that right?
Yeah.
That
And
are fixed, that don't come in and out?
we can do that. We sure can. We not only stabilize dentures, but we have that patient that maybe we've stabilized their denture, and they come back in and say, this is so great. I wished I could, have my teeth back like this. Is there any way you can give me my teeth back and not have to wear the denture with all the plastic? Yeah, there is. There sure is.
But isn't it true that if you've been wearing a denture, let's say 25 or 30 years, you don't have enough bone to do this?
That's not true. That's just not true. There's always something we can do. Now with the mini implant, there is something we can
But
do.
does that come up in your area? Like
Yeah, well, it does now.
because I think you told me, you say that some people are told they don't have enough bone.
That's correct. Yeah, all the time. I'm many times not their first appointment. I'm their second or third or fourth appointment. Maybe they've already seen their general dentist. Maybe they've been to a specialist or two, and they've been told that because of age or because of being medically compromised, that they're not a good candidate for bone grafts. That they need a bone graft to have the implants, and they're not a good candidate. So they've already been told.
So you rarely do bone grafts nowadays?
I rarely do a bone graft. I have bone graft material, and 99% of the time, maybe more than that, I don't do a bone
So
graft.
what are you doing differently? Why are you able to do it and they can't do it? Help me understand
the mini
that
implant.
part.
It's the small diameter implant. For years and years and years, we built bone. If they didn't have enough bone, we built bone to house these larger implants, and they work. They work. I'm not saying they don't work. It's just that we had to build bone for that. Now we just use the bone that's available, and we're having a lot of success with
What
it.
about pain?
Very little pain at all. Now, sometimes I will send the patient home if we've done several. If I've done 3 or 4 or 5 implants, we'll send them home with a prescription for some pain medicine. But usually we just suggest they use an over-the-counter medication. The thing about denture wearers is the reason they're not doing it is they think they're too old, or they've been told that they're medically compromised.
Well, how old can you be?
Well, I have placed mini implants 4 weeks ago. I placed 4 mini implants in a 97-year-old lady.
Why would she want to do that?
She didn't. She told me. She looked at me right in the eye and said, "Listen, I want you to treat me like I'm 40 years old. I don't want something that comes in and out of my mouth. I want something that's glued in like I've always had." So with her, what we did is we placed 4 implants, and we fixed her some teeth that just glued in. They didn't come in and out. I mean, she walked out of my office with a fixed set of teeth.
So a full arch of teeth.
Yeah, she did great. I mean, she was so confident. She told me, she said, "Listen, I'm going back. I'm going to be playing bridge with some of my friends, and I don't want my teeth to move around or fall around." And now, when she's with her friends at that bridge game, she can bite into a sandwich if she wants to. She can eat. She can laugh. She can look around and talk to them, and in the back of her mind, she's not worried about her teeth moving around. So she's just so happy. She's just ecstatic.
So a denture wearer comes to you.
Yes.
You give them a fixed set of teeth anchored onto these mini implants.
Uh-huh.
How soon can they eat?
As soon as they walk out of my office, they can go to a
Really?
meal. Let me tell you a story. I had a gentleman come in my office, 94 years old. He sat down in my chair. He's a retired minister. And he said, I said, "Hey, I'm Randy Staples. What can I do for you?" He said, "Doc, I want to be able to have a steak and eggs again before I die. I want to eat steak and eggs again." So I can eat, but pureed food just doesn't cut it for me. A pureed steak is just not good. So I looked in his mouth, and I determined that he was a candidate for mini implants. Didn't have a lot of bone, but he had enough. So I told him what I could do, and he said, "Let's do it." So the next day he came in, and we put in some mini implants and stabilized that lower denture. And he and his wife walked out of the office and went to IHOP. That's where he wanted to go. Went to IHOP and got steak and eggs. And his wife said not only did he eat his, he ate some of hers too. And he would come back in to have his denture checked, or me look at his implants. And he would go around in the waiting room and sit down by different people and talk to him about what Dr. Staples had done for him and how he could chew again. And he could eat anything he wanted. He didn't have to eat pureed food or cottage cheese and peaches. So he was just a really happy guy.
That's something you told me on the telephone. You said that you were in a rut, like in 2009.
Yeah.
You lost your passion for dentistry.
I had lost my passion.
Then you found mini implants.
Sure did.
And now you're excited again.
I'm really
Elaborate
excited
on that. What do you mean?
Well, I'd practiced dentistry since 1977, and like I said before, people would come in pain, and we'd get them out of pain, and we do fillings, we did crowns, we did a lot of things for folks, but and we did help them. I mean, they did thank me. But when I started doing mini implants, I mean, these people are so happy. You're giving them something that they haven't had in years, maybe. Can you just imagine right now, you're going to go out and eat this afternoon, and you're already thinking in your mind, I don't know what I'm going to eat. I'm going to be out with friends. I'm going to have to really watch what I order, because I don't want my teeth moving around. Can you imagine that? Can you imagine not being able to eat?
That sounds tough, yeah.
Yeah, and so...
so there's a lot of people like that.
A lot of people like that. I had a lady that came in one day and sat down, and I did the same thing. I come in, "Hi, I'm Randy Staples. What can I do for you?" And she said, well, I want you to help me with my mouth. And that's why she talked to me with her hand in front of her mouth. And I noticed she had a sack over there that was full of dentures. And I said, well, how long have you had dentures? And she said, I had my dentures when I was 20 years old, and now I'm 50, and I get a new set of dentures every 3 or 4 years. And I said, well, I know you've got a lot there. She said, well, I just can't wear them. None of them ever fit. And so I took her last set that she just had made, and I knew that they probably touched her gums everywhere, and I put them in her mouth, and she started gagging. And so I knew immediately that was a big problem that she had, was gagging. So I told her, I said, well, you've got enough bone. We can take this pair. I can do a little trimming on them so they don't trigger that gag reflex. But I can stabilize these, and I think you'll be able to eat. So we did her lower first, and she was just so happy. She asked me if I could do her uppers the next day, and I did. And we were able to trim the palate out. If I had a denture, I can show you, but they have that palate that's in the denture.
The roof of their mouth.
The roof of their mouth's covered. We got to trim that out. She and her mom, after I stabilized her denture that day, they went to a restaurant about 20 minutes away from the office, and they had lunch together in a restaurant, which they hadn't done in 15 years. And they did that every day for about 2 weeks, just because they hadn't had a mother-daughter dinner in years.
Right.
Every function that she had was done in her home. She would glue her dentures in the best she could, and run to the doctor or run to church or run somewhere. And she tried to get back home within an hour and a half, so she'd get those out. She had all her family functions in her home, all of her meals at Christmas and Easter and family reunions. She did everything in her home. And everyone in her family knew that she couldn't wear teeth, so that was acceptable. But she was kind of a recluse, and we just kind of opened her world up again. And she came in and hugged my neck and everybody in the office and said, "You've changed our life. You've changed my life. I want you to know you've changed my life." And that's a great thing to be.
So that's why you have your passion.
That's where my passion is.
Because you said you're transforming people's lives every day.
Every day. Just almost every day we're doing a mini implant on someone.
I mean, you've done, by the way, like over 5,000 of these.
By now.
A lot of experience. I mean, one of the most experienced guys doing this.
Well, there are people done a lot more than I have. But I mean, I'm still doing general dentistry too, and eventually I would love to just be doing mini implants.
But you kind of preach to even your buddies that are dentists.
Yeah.
That they got to do this.
Got to do this. If
it's a
all,
game
if
changer
all
for
they
you.
do in their practice, if they don't do dentures even, if all they do is just replace that one missing tooth instead of cutting down those two beautiful teeth on either side and doing a bridge, if that's all they do, they've done a service to their patient. Not cutting down those virgin teeth. That's what we used to do. If someone come in with a missing tooth, maybe they had a little flipper or something in their mouth to replace that tooth, we'd numb them up and then cut those two beautiful teeth on the other side and make a bridge that glued in place. Yeah, it looks great, it looks pretty, but now you've actually damaged two other teeth. You've opened those up to possible root canals or recurrent decay or maybe something. And then what happens then? If one of those teeth that you've cut 10 years from now, if one of those, something happens to it, well, maybe you lose that tooth. Now you got a 4-unit bridge or a 5-unit
So if you're
bridge.
missing a tooth, just even one tooth, an implant's the way to go.
Every day.
Is it less expensive or more expensive?
It's less expensive. Lots
Really?
Yeah, sometimes less than half.
So what then are their options
Okay.
as far as mini implants?
Say the first option, place some mini implants, and then make them a set of teeth that snaps in and out, that they can walk out and go eat a meal.
Okay.
Maybe the next option is to add a few more mini implants and make a set of teeth that looks more like teeth without the pink plastic everywhere. It really looks like, when you smile, it looks like teeth coming right out of your gums. And then maybe the last option is more mini implants and make a set that glues in, that doesn't come in and out. So we've got a lot of
It seems like everybody wants a fixed set of teeth, right?
Everybody wants teeth.
You don't
that
want teeth that
snaps
don't
in.
come in and out.
Yeah, that's one thing that denture wearers tell me. For instance, used to at nighttime I'd have to take my teeth out. Now I don't. I wear them, and it's great. It just feels like I've got my teeth back again.
So people in their 70s doing this, people that are dating with dentures,
Absolutely.
they're
70s,
converted.
80s, yeah.
So you could actually even use their denture.
You can, yeah, if
And
they
make
like it.
little
If they
snaps in
like
there?
their denture. Some people are walking around with a denture that they don't like really. Maybe in the back of their mind, or they may even told someone, this really doesn't look like my teeth used to. Sometimes people will bring in pictures of 30 years ago of their smile. So I really wish my teeth looked like this. And we can do that. We can take that picture and make their teeth look like
So they
used
look
to.
real. They can look real.
Absolutely. They can look just like natural teeth. Sure can.
Now, a lot of guys go to you like for these second or third opinions. Like
Right.
you're the last hope guy.
Mm-hmm.
Is that true?
Yeah, it's funny you said that. I had a gentleman not even a year ago that came in and sat down in my chair, and I walked in and I said, "Hey, Mr. Al, what can I do for you? I'm Randy Staples. What can I do for you?" And he looked at me and said, "You're my last hope." Well, it's very rare that you're someone's last hope, And I said, "Well, Mr. Al, what do you mean?" And he said, "Well, I've been told I'm too old. I've been told I got too many medical things wrong with me. I've been told I've got a crazy, funny bite that they don't know how to work with, and I don't have any bone, and I can't get a bone graft. So they just told me I had to live with it. Just, I'd start having to drink Ensure and eat soft foods and maybe puree my food." And, my best friend I was playing golf with the other day, and he said that to come talk to you. So I looked.
So he was referred.
He was referred to him as someone else, and he said, I've been to 4 other doctors, and they've told me these things, and my friend I was playing golf with said, "Go talk to Dr. Staples." So he came in, and we.
So he was skeptical.
He was real skeptical at first. Well, he'd been told by professionals that, like I said, he didn't have enough bone. He was too old. He had a bad bite.
So he couldn't eat with his current dentures.
He didn't have any. He just had 6 teeth on top and 6 teeth on the bottom.
So they had to be extracted.
They had to be extracted. Yeah.
Okay, and he knew he didn't
And
want
they
a
couldn't,
denture.
and they couldn't fit him with dentures or partials.
Now, so when you're on this console, I'm just curious. How soon in your mind do you go, "This is going to be an easy one," or "This is going to be great"?
Well, I knew with his bite, it was going to be a little challenging, but it's not going to be impossible. I mean, when someone tells you their last hope, I'm going to do everything that I can do to make sure that I was his last hope and that I solved his problem. But even more so, just to give him a mouth that he could chew with again and smile again, enjoy his life. Everybody deserves to smile. Everybody deserves to chew their food. I mean, and if we have something, I've got a mini implant now. I've got something that I can give back to people, their smile. I give them back the ability to chew again. With this procedure, it's just it's changed my life, and just like it's changed the lives of my patients. When we got through with Al, we had teeth on the top that were cemented in place. We had teeth on the bottom that snapped in and out. But he could go to a restaurant, he could eat, and his teeth stay in place. The last hope thing, we gave him his teeth back, and we gave him his smile back, and gave him something he could chew his food with. He didn't have to go buy that Ensure.
So these are happy patients. Do you ever run into patients around town?
All the time. Do
they ever tell you
Jackson's not a metropolis, so we see people all the time.
Do they ever tell you their eating stories? Like, "Hey,
all
Doc,
the time.
thanks."
Absolutely, yeah. Say, "Thanks, Doc." Said, I've got to come back in and see you. Just let you look at me, or I've got a friend that I want to send over to you. But yeah, all the time.
You say that denture wearers, when they're out and about, they talk, or not out and about, when they're out to eat or whatever, they talk about what adhesive they use.
Yeah, I'm sure they probably wouldn't talk to you about that. And they may say something to me if they came in. What's the latest, greatest? Is there anything new? But I'm sure that when they're together, they're saying, what kind of adhesive are you wearing? Are you using the paste? Are you using the powder? What are you doing? But is there anything new? And they're looking on the internet to see if there's anything life-changing on as far as denture adhesive.
So in one day, couple of visits, they can walk in, a denture wearer can walk in, walk out with a full arch of teeth that don't come in and out.
Same day. If they have a denture that fits their gum and have a pretty good bite, and we can use their denture and put mini implants in, and they can walk out of the office within an hour and a half.
These mini implants should not be confused with traditional implants.
Okay.
I guess they're smaller and they work.
They're smaller and they work.
And there's been studies following patients for a long
there have
time.
been studies. There's a study that came out last year before last, 10,000 implants, over 5,000 patients, but over 10,000 implants. And we're having just the same success rate as traditionals, yeah. Sure.
Okay, good. So you love these.
I love
Patients
them.
ever give you a hug?
A lot.
Do they really?
Yeah, and not just that. I mean, let me tell you this. I had a lady that we were using her denture, and we just placed her implants, and we were going through. Without getting technical, we were just about to take her implant out. I mean, her denture out and kind of polish it up. And I told her, I said, "Now it will come out. Don't worry, it will come out, and then we're going to polish it up." And I started trying to take the denture out, and she started crying. And I said, and I thought that I was hurting her, and I said, I'm sorry, I'm so sorry. And she just said, like that. And I went ahead and popped it out. And I said, I'm sorry, I'm gonna leave and clean this up and let you kind of get composed. And she said, Dr. Staples, she grabbed my arm and she said, you weren't hurting me. She said, I just can't believe that they're gonna be that tight. I mean, she was so excited that I had that much difficulty getting them out of her mouth that she started crying for joy. She wasn't crying for pain, she was crying from joy. And she gave me a hug, and she gave everybody in the office a hug. I think she probably hugged everybody in the waiting room.
So you stabilize their loose-fitting denture, and now could they eat something like, let's say you put together a fixed set of teeth with them? Can they bite with their front teeth like
Absolutely.
a corn on the cob?
Apple, corn on the
Is
cob.
that right?
Absolutely, sure.
But they have to be careful.
No, not
No?
really. No, not any more so than their natural.
Are they
teeth.
afraid? Did they ever call you and say, are you sure I can eat
yeah,
this soon?
after a week or two, even though I tell them you go out and eat what you want to, don't avoid anything. Just go ahead and eat. They'll come back in a week or two, sometimes, or months, and say, "Well, I still haven't really eaten anything really, really hard." And I'd say, "Why? Is it hurting?" No, I'm just kind of scared. I'd say, "Well, go ahead and eat. That's what they're for. Go ahead and eat."
Now, what about the crowd of people that their teeth are really in bad shape? They have like gum disease.
Gum disease.
Are their gums too far gone to be able to take these mini implants?
Well, maybe they do have gum disease, and maybe their gum and their bone support of their teeth is too diseased to save those teeth. But the good news is now that if we lose those teeth, they're not going to be doomed to a denture that flops in all over the place. Once you take those teeth out, the periodontal disease is gone.
So the infection goes away.
Infection goes away.
And gums get healthy?
Gums get healthy again.
All
Then
right.
we can go in there and put those small diameter implants, make them a denture that snaps in, and snaps in and out, that they can chew with, that stays in place, it's stabilized. Yeah,
And we were talking earlier about why they all don't do it. So people just don't like going to the dentist, right?
that's correct.
I mean, you must hear that.
I
right?
hear it.
I don't
hear it.
like going to the
I
dentist,
hear
and
it
I'm not
sometimes
afraid of the
because
dentist.
it's a pain factor. Yeah, that's true. I hear people say that all the time. Don't take this personal, but you can fill in.
What do you say?
I
Like,
don't-
no offense,
I try
doctor.
not to take it personal. But I understand. Where they're coming from. I mean, they come in and have to get a shot and have a filling done or a root canal done or whatever. They've got a problem. They associate me with the problem anyway, instead of solutions. They've always associated me with problems.
But when it's
instead of
all
solutions.
done and you give them, let's say, a fixed set of teeth,
Yeah.
now they're coming in for cleanings, things like that. They're like a
Yeah.
different, they're not afraid anymore.
Not afraid anymore, and they're referring people and bringing people in too. They want to give their best friend, let them have their smile back.
Is that right?
Yeah,
So denture wearers are telling other denture wearers.
absolutely. After they had these mini implants, yeah, they sure do.
So we only have about a minute and a half left, but these mini implants are a lot less expensive than traditional implants, and according to you, they work.
They work.
You could do the same thing almost with them, just a
Absolutely.
little bit more mini implants.
Right. Had this one fella. I know we're about out of time, but I had this one gentleman that came in. He'd actually lost teeth in college, and he'd been wearing a flipper like you've seen hockey players wear, those little flippers where they had their front teeth knocked out. He'd been wearing that for 7 or 8 years. He's a registered nurse. His wife's a registered nurse. They live in Jackson, and he went to someone to see about getting his teeth back, and they gave him a figure, included bone grafting and traditional implants and the crowns, and it was a lot of money. And he went home and he sat down with his wife and he said, what we're going to do tonight is we're going to make a way so I can afford to smile again. I want to get my teeth back. And she said, it's funny you said that, because driving into work today, I saw a billboard that showed a guy's picture, Dr. Staples, and said, you can afford to smile again. He said, why don't you go talk to him first? So he came
Is
in.
that right? It's a
Yeah,
good
he did.
story.
He came in the next day, and he actually told me, what he'd been treatment planned. And I looked in his mouth, and yeah, if he had traditional implants, he did need a bone graft. He really did, because he'd lost some bone up there. But he had enough bone for minis, and I just told him, I said, well, we need to give you mini implants, or you can have mini implants and crowns, and we can do that in a couple of weeks instead of a year. And this is what the cost would be. And he just reached into his back pocket and did like this and pulled out his checkbook and started writing a check. And I said, wait a minute, it's 12 o'clock. My well, we're going to lunch. And he said, well, I'm not got anything to do this afternoon if you don't. And I said, okay. So I called one of my assistants, and she came in and brought the material, and we actually placed 2 mini implants in 30 minutes, less than 30 minutes, and took impressions to send to a lab to make his permanent teeth. I would have already had them for him if this was a consultation appointment.
So he just walks
He
in.
just walked in, yeah, and he was so happy. And he was a candidate, and so we made it happen.
So what's the follow-up with him?
This guy's a patient of ours now. He's got a beautiful smile. He's always smiling. He's just so tickled. He never fails to say something about his mini implant smile. And his wife's a patient of ours now. And he's just a happy camper.
Is this one of those things where they say, I should have done this years ago?
That's what he said to me. He said, I just didn't realize it was that simple. He said, I always had in my mind and had been told that it was going to be a real detailed procedure. So I just didn't know it could be done that fast and not cost any more than it did and not hurt and just be, get my smile back that fast.
So it's about smiling, laughing, chewing.
Getting your smile back.
How important is a smile in your opinion? You're a dentist, and we have about a minute left.
Well, it's tremendously important in your job and in your well-being at home. Just the persona that you give out when you're walking and meeting new friends, or maybe you're going for a job interview, or you're just in school. With peer pressure in school, you want a kid wants to be able to smile, and in an adult world, it means everything. That person that you see that has a really nice, pretty smile, as opposed to someone who's very reserved.
So there's a lot of. Do you spot these people where you are? I mean, could you tell the people that hate their smile?
If somebody comes up to you and you're talking to them and they're smiling at you, you just you get that feeling of well-being.
Yeah.
And whereas if I'm talking to you and I'm real serious and like this, what do you think? You already have made something in your mind. You've already decided what kind of person I am. If I'm mad or if I have a bad persona, you already have that up. So I think smiles is really important.
It's affordable, you say. In fact, you had a billboard. What does the billboard say?
You can't afford to smile again. That's in a lot of my advertising.
You can afford to smile
again. You can't afford to smile again.
So what do you say to the person watching this? They're wearing a denture, right? Or the person that they're headed to a denture. Their teeth have to go. But they're still skeptical or afraid or whatever. What do you say to them?
I say if you are wearing an ill-fitted denture, it doesn't have to be that way. I mean, we can provide you a denture that snaps in place. Almost everybody that walks in the office is a candidate. I have seen a few people that maybe I couldn't work on.
But if you have osteoporosis, a little bit, you're okay.
Do it.
Because you said 97-year-olds are doing
bleeding disorders, do it. I mean, there's just a lot of things that we can do. We don't take them off their blood pressure medicine. We don't take them off their blood thinning medicine. If they have osteoporosis, sometimes we can still do it.
Good.
There's very few people that aren't candidates, and if they're headed toward a denture, don't worry about it. We can provide.
See Dr. Staples.
That's right.
All right. I want to thank you for coming on the show.
Thanks a lot. I
Good
really
stuff.
enjoyed it.
Good stuff. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.